So generally when we think of liver disease or a fatty liver, we often associate that with alcohol. Well, today I'm here at Pinnacle Clinical Research with Dr. Mary Margaret Era, and we're going to discuss an opportunity for you to get your liver tested to see if you may be vulnerable to a disease like any fatty liver, things like that. And we're going to learn about how it is not always associated with alcohol use. Thank you for joining me today.
Thanks so much for coming. You're absolutely right. So actually, metabolic causes of fatty liver disease are more common for females and sort of equally common for males as alcoholism.
Okay, and so what are some signs that we would look out for as to whether or not we have any type of liver disease, especially a fatty liver?
The concerning thing about fatty liver is that it's a very silent disease, so there really are not a lot of symptoms. Somebody might have a little bit of vague fatigue, things like that, but usually it's discovered when people have other issues and they go in, let's say, a gallbladder or pain or something, and it's found incidentally.
And that's really important to listen to your body, because these slight symptoms like being tired could be just seasonal. You know, I'm very busy, we're in the season of life, but it's important to pay attention to those signs because it could often lead to discovering
it could be indicating something else.
Absolutely. So when we have those signs, why should we come see you, and what are you able to do for our community?
The main thing to do is that we know that metabolic syndrome is one of the reasons that's leading toward this fatty liver. And what is metabolic syndrome? It's when people are maybe on the overweight or obese side, but they're holding that weight in the central portion of their body, right around the trunk. They might have diabetes mellitus, they might have high blood pressure, high cholesterol, or sometimes abnormalities with their thyroid. And if patients are having one or multiple of those things, they should just come ahead and get checked.
Okay, and by getting checked, we're talking about a free scan that they offer. What do we expect when we come in for that scan?
It's a scan called a FibroScan. Now, you need to be fasting to have that scan done, but it is a non-invasive test that sends a little sound wave over the liver. It takes maybe 10 to 15 minutes, and then we discuss with the patient afterward what the results show. The test is telling us whether or not there's fatty cells in the liver and whether or not there's any fibrosis or stiffness of the liver. The stiffness is when we're progressing through liver disease and being more serious.
Okay, and at this time there is no quick fix, there's no medication necessarily, so we're really depending more on clinical trials, is that correct?
Well, there's no FDA-approved medication for fatty liver. So if you have one of the other issues, you go to the doctor, you get a prescription. That's not the case with fatty liver. So we're trying with clinical research to figure out what that result might be.
Okay, and by doing the test, you're not entitled or committed to doing any type of clinical research?
No, the clinical research is all voluntary.
Fantastic. So the more you know, it doesn't hurt to come in. It's a free test. Now, are there some things, adjustments we can make in our daily lives to help prevent or reverse a fatty liver?
Absolutely. It's a new year, new things. I recommend that everybody get in at least 30 minutes of walking every day. If you have not been walking at all, probably start off slow and build up. Try to cut back on carbohydrates in the diet. No drastic cutbacks, but slowly and over time make some positive changes. And then try to cut back alcohol. If you know that you have a little drink here or there, maybe try to reduce it somewhat to take some effects off the liver.
Fantastic. Well, thank you for the free advice, and you can get the free scan. So we've got lots of opportunity here. How can we get more information from you guys or schedule our appointment?
Absolutely. If people think that this sounds like something for them, give us a call. There's no harm in just giving us a call, and we'll give you further information to come get it scheduled.
Fantastic. Well, thank you so much for this useful information. We want you to all have a healthy and prosperous year. So stop by and take care of yourself, take care of your health, and don't forget to mention Coastal Living sent you. Thank you so much.
Thanks so much.